follow-up email. There will also be time for questions, and feel free to add questions to the chat. With that, I will pass this off to Ellen Vollinger.
Brittany, thank you so much, and thanks to all of you who are joining us today. Surveys have been corroborating what many on this call know from their own experience and their work with community members. That is that COVID-19 is taking a toll, not only on health, but is causing serious hardship across the country. Since March of 2020, Propel has surveyed a sample of their SNAP customers monthly to gain insights into those customers' experiences during COVID-19. Propel's app, now called Providers, it used to be called Fresh EBT, now has 5 million SNAP customers. We're pleased to have Julieta Cuellar, who is Propel's Policy Research and Communications Manager, here with us today to share the top line findings from the most recent monthly survey, that for September 2021. As Brittany said, feel free to use the chat to make comments, provide feedback, and do submit your questions. Julieta, I'll turn it to you now. Thanks so much for being with us.
Thank you, Ellen. I'm going to start sharing my screen so you can see my presentation. Just a moment. Okay, so as Ellen shared, I'm going to be presenting today on our most recent household pulse survey, which ran in September. But first, I want to tell you a little bit about Propel and Providers. So at Propel, we build modern, respectful, effective technology that helps low-income Americans improve their financial health. And we do this through our app Providers, which is the only app out there that allows people to see their benefits, manage those benefits side by side with a free debit product. And this is of increasing importance now because benefits like the child tax credit are arriving as cash. So people can see those benefits all in one place, what's on an EBT card versus like what comes in a bank account or a debit card, and manage it in one spot. So a little bit on our users. We have over 5 million monthly active users across the country. So we have people active in all 50 states and in 3 US territories. We see about 2 million people on any given day using the app. The majority of our users have children under 18 in their households. The vast majority are women, and we estimate that we have about 1 in 4 of all households that receive SNAP using our platform. So a little bit about this month's survey. It's a 10-minute survey every month, a mixture of multiple choice questions and a few open response questions. We had a pretty large sample in September of over 7,000 users of our over 5 million total user base. And the survey ran for the first 2 weeks of September, and all our respondents are EBT cardholders. So here are the top level findings from the September survey. First, we found once again, as we did last month, that the child tax credit payment reduced, for those who received it, reduced housing, food, and financial insecurity. We're continuing to see a housing crisis affect the users. In particular, evictions and utility shutoffs reached their highest level in September. We also found that more of our users are getting sick, reporting working less and losing jobs in the past month. And then a measure of financial insecurity, borrowing to cover expenses, has increased, as have the levels of debt that users are carrying. So diving into that first one, we compared families. So of all users who say that they have children under 18 living in their households, and we take that as a proxy for them being eligible for the child tax credit, we compared those who received the August child tax credit payment versus those who did not. And when we looked at that comparison, we saw that there was a statistically significant difference on a number of measures. So here they are. Families that received the August child tax credit payment were more likely to say that they lived in stable housing and that they were very certain that they'd be able to stay in their current housing for the next 30 days. In addition, they were less likely to report having been evicted in the past month, having slept in a shelter for at least one night in the past month, to say they didn't have most things they needed in their homes at this time, less likely to say that they'd visited a food pantry in the previous month, less likely to say that they missed an appointment, going somewhere, or work because they didn't have a way to get there, and to report having less than $25 on hand. However, some people are still missing out, people that we think are eligible. In particular, we see that there are people who speak Spanish, people who complete the survey in Spanish versus in English, were less likely to report that they received the latest child tax credit payment compared to English speakers. And in addition, we saw a notable difference between people who describe their current employment status as unable to work. And here you can see a response from a survey respondent. Someone who did report actually that she has children in her household and hasn't received the child tax credit payment, sort of highlighting the difficult situation that she's in. So we've been asking for the last couple months among those who received the child tax credit, how has it affected your family? And I'll let you read these responses from our users. And you can see the connection with the findings about people having a way to get around, people being able to provide for their children with very limited means. And a couple more responses from our users. I love this response on the left from this person in West Virginia talking about how they got married. There's always these, we've asked people also, how did you spend the child tax credit? And we left that open-ended versus it being a multiple choice question, precisely so we can get some of these more unique responses on what difference it made in people's lives. So moving on to the housing findings. As I mentioned, evictions have reached their highest level since we started asking about it in a year ago, September 2020. So for the first time, the portion of users reporting being evicted in the past month surpassed 5%. And just to clarify, we ask people if they've been evicted by family members or other people they live with, if they've been evicted by a court order, if they've just been evicted by their landlord. So in the way we structure that question, we're trying to capture both, you know, legally executed evictions as well as informal evictions that we know also happen. In addition, 4% of users reported sleeping in a shelter at least one night in the past 30 days. And as I mentioned, utility shutoffs have also peaked. Almost 11% of users had their utility shut off in the past month. And we see a racial discrepancy here, as we do in many of these measures of hardship. Black users were almost twice as likely as white users to report that their utilities had been shut off in the past 30 days. So moving on to employment, we're seeing this month that more users have been reporting getting sick, working less, and losing jobs. 11% of people reported losing a job in the past 30 days, which is up 2 percentage points since last month. 22% of users said that they got sick in the past 30 days, which is up quite substantially, 6 percentage points since last month. And then 50% reported having their hours reduced, and that's up 4 percentage points since last month. And here's a quote from a user this month that highlights that hardship. And then to the last finding, borrowing to cover expenses has increased. We've been tracking this for a year now, and it's reached its highest level. Almost 61% of users have reported borrowing or using credit to cover their expenses in the past 30 days. And over half also say that they have less than $25 on hand when surveyed, and that's at the beginning of the month, or at least in the first half of the month. In addition, we've seen that levels of debt have increased. We ask people every month, how much do you owe in back rent or mortgage payments? How how much do you owe family and friends? How much do you owe on your utilities or other bills? How much do you owe on credit cards? And then how much do you owe just in other kinds of debt? And we asked them, for ranges of amounts as well. But bottom line, across every one of these categories, more people report owing money. And here's another quote from a user highlighting this hardship. So I'm going to spend a little bit of time here at the end talking about the child tax credit more broadly, because I think it's of interest to many of you. So in addition to that household pulse survey I just presented on, we also are trying to track the receipt of the child tax credit pretty closely. So in the September survey that I just presented on, it's the first 2 weeks of September. So we're asking people about the August child tax credit payments, right, the previous month, to get more real-time data on the receipt of the child tax credit payments. We also have this pop-up survey that comes up in the app for users who indicate that they have children under 18 that just simply asks, did you receive a child tax credit payment? It actually looks a little different. We ask people if, instead of just yes or no, it's yes, I received it by direct deposit, yes, I received it by mail check, no, and I'm not sure. And for September, we saw that, sorry, this number is incorrect. Say 79% received the September payment. 71 received it via direct deposit, 8% via mail check. 15% of people said they didn't receive the September payment, and 6% are not sure if they received the payment. So these numbers are a bit of a drop, and what we're seeing was an upward trajectory, progress towards more people receiving the child tax credit payment. For those of you who don't know, there was an error in September that affected, I think the IRS estimates 2% of people's payments. I think it was a higher proportion of our users were affected, in which some people just didn't get the payments, their September payment on time. And some people, I think, still haven't gotten it. Other people got it late in the month, and some people got partial payments. So that's why I think we're seeing a drop off. Overall, it was a 5% drop in people reporting getting the payment, and a 25% increase in those who said they didn't get it. We've been following 10 families who are providers users since July. We've been interviewing them every month and surveying them. They all have children under 18. They're all eligible for the child tax credit. And the past few months in these webinars, I've been presenting a little bit about what we're learning from them. Among the findings, I think a few months in, parents are really starting to think towards the future, dream a little bit, because they're, after a few months of payment, have been able to kind of dig themselves out of, in many cases, the debt that they've gotten into as a result of the circumstances of the pandemic. One of the participants in this project had talked to us about, thinking about planning a trip for her daughter to visit New York. She always wanted to do it as well, and thinking about getting the second half of the child tax credit and overall her tax refund is allowing her to think about this. She says, when you don't have a financial struggle, you feel good. I can't thank the government enough. And talking about the child tax credit payments. Another one of our participants wants to buy a house, and with the September child tax credit payment, she put a deposit towards a credit improvement program, and she's hoping to finally achieve the dream of owning a house by next year. And every month we're putting resources in the app that help people who are eligible to sign up for the child tax credit payment if they haven't already, by directing them to a non-filer sign-up portal. And in addition, we try to make it easy for people to update their payment information or check the status of their deposit. So this is the hub you see here on the left that we make available every month to users. And this time we also added this little block at the bottom that gives people the opportunity to advocate for the child tax credit to be extended. And this is a partnership that we're doing in collaboration with Stand for Children. People click that little box at the bottom, it directs them to the page you're seeing here on the left, in which they can share a story about what difference the child tax credit payment has made in their lives. And it gets sent to their representatives. Oh, I guess that's all I have. So thank you very much for your time. You can see my email here if you want to reach out to me with any specific questions. And you can also go to joinpropel.com/learn, where we post the insights I just presented for September on our website. And we also just published a report that's particularly focused on the impact of the child tax credit. Thank you.
Julieta, thank you so much for doing this and for sharing all the information. We do have a question from our partner about whether or not you're able to attribute the incidence of sickness, of more illness, whether that's directly attributable to COVID, or do you not know what the circumstances are? Do you have any speculation about that?
We don't know, and that's honestly something that I think we've considered improving, and maybe we should next month, is to specify that it's for COVID. I think it's implied, but it could help to be clearer.
It's certainly that, and the findings about being out of work more and so forth really underscore that the hardship of COVID and the crisis of COVID is not over. Neither the health aspects are settled, nor, and we knew that even when the health pandemic ends, that there still will be serious economic repercussions. And unfortunately, I think your findings underscore that. Do you have any idea what is helping your users find out more about the child tax credit? In other words, are there ways that you promote it with your hub that are driving more users to use that hub and to follow up? Do you have any ideas what motivates people to learn more about it?
Sure. I just wanted to add something to what you were mentioning previously. I only focused on one aspect of what we learned from the interviews that we conduct with those 10 families every month. Another thing, though, was in the last couple of months, stories emerging from users about how the child tax credit payment, if they're receiving it, has helped them deal with unexpected loss of work or income hours due to COVID. And it's not necessarily them getting sick. There was one mother who got her vaccine and got ill after that as a result, and she missed a week of work. There was another participant whose coworker, the person who subcontracts her, was ill with COVID for I think about 3 weeks, and she wasn't sick, but she couldn't work during that time. Unfortunately, she wasn't receiving the child tax credit payment, so she was sort of at a loss with how to cover her expenses. But returning to your question, which now I might need you to repeat.
Just I'm wondering, what you're finding is helping with the take-up rate on child tax credit. Maybe
Yes.
when you see more users turning to that part of your app.
Well, we always have child tax credit information available in what we call our benefits hub, which is a place in the app. It's like the most used featured of the app, I would actually say, in which we give updates on all sorts of benefits, state by state updates on SNAP, on PBT, on things like emergency rental assistance. So the child tax credit payment information is always in there, and actually that drives most of the signups to, like, for people who aren't currently receiving it. And then what we do, I think the second source of the most signups is the hub that I showed, and we direct people to that towards the end of the month. They kind of see it in the wallet of the app. And it's like add your CTC payment here, and people click on that and they get directed to that hub. And we target it with a deadline, because there's a deadline every month to make changes to your payment or to sign up. So, for example, for the October payment, it was October 4th. So up until yesterday, we were kind of promoting it with that deadline.
And you've got a couple of questions that have come in terms of sharing the data that you have, access partners might have to it, and our our allies in Oklahoma particularly interested in whether or not there are findings that they could say are specific to Oklahoma. So if you want to give people some thoughts about that, that would be great.
Sure. So the smallest geographic unit, I guess to answer the first question for analysis, is zip code we have. However, we don't really analyze it by that level of specificity. The sample size in this month in particular was really large, almost 7,500, but generally it's about 5,000, maybe a little over 5,000. Once you break it down into something as specific as zip code, we have pretty few responses. So there's not a lot of power in that, in analyzing that data. We don't even really break it down by state very often for the same reason, although we can. So the person who's interested in Oklahoma information, if you want to contact me, I can see if there's some specific questions you have and see if I can answer them. But Oklahoma is not a big state where we get a lot of responses. The kind of top 10 states where we get responses are the big ones like California, Texas, Florida. Michigan is often in there sometimes, like Ohio, Georgia. So I'm not sure how much information I could give you on Oklahoma specifically. I think that that's in general the power of the provider's platform and the surveys that we do is that we have national reach and a pretty quick national reach. But once we kind of break down into state specific, we lose some of the power of our work. So someone is asking about Indiana. Okay, maybe I'll respond. So what would the appropriate contact Propel be to share state area information for Indiana? You can just contact me and I will direct you. And would zip code level data be able to be shared for a specific state if requested? Potentially, but you can contact me and I will let you know.
Seems like all roads lead through you, Julieta, which is really important. I can't imagine that when Propel started doing these monthly surveys that you could foresee that COVID would be extending during this, this length of time. This is a lot of surveys to have done since March of 2020, and I assume that you're planning to continue these regular monthly surveys for the foreseeable future. Do you have any particular game plan in mind?
Well, the household pulse survey in its current form on a monthly basis is going to be continuing through at least the beginning of next year because we've partnered with Poverty Solutions out of the University of Michigan to share that data for an academic study on the impact of the child tax credit. So that's going to continue at the very least. And then I think we're going to be assessing the future of that, of this household pulse survey towards the end of this year. As you said, it's really started as a quick way to try to understand how COVID was impacting our users. And in the year and a half that it's been going on, I think that it's shifted to assess a number of things, ongoing effects of the pandemic, and also the impact of the various government programs, benefits extensions that emerged and their effectiveness, and then frankly to advocate for them to continue. So we will see where it goes from here. So I'm going to share my contact information again here, just my email in the chat for everyone. And for state specific information or questions, you could contact me. Like I said, with the caveat that we don't necessarily get a lot of responses for the state in question. So we may not have a lot to say, but I can follow up with you.
Great. Julieta, thank you so much. And I would say kudos on the effort you're making to advocate for the continuation of the child tax credit and to have it be permanent, because that is really important. And I know people who are in our community are working really hard on that. And I'm sure that the voices of your customers are going to be, very important for policymakers to hear. So to the extent that you're making that pathway to speak up a little easier for people to navigate, that is really, I think, quite a contribution. So we appreciate that. I'm going to turn it now back to Brittany, who's going to close us out. But Julieta, we can't thank you enough for the continued partnership and the work that you do, and the important information that you bring to the policy debate. So thank you.
Thank you very much.
All right, what a wonderful webinar. Julieta, thank you again so much. Everyone, thank you all for attending. Please be reminded that we will be sending out the recording and a copy of the slide deck as well. Also, Julieta's email is also in the chat if you would like to copy it before you leave. Thank you again and have a wonderful rest of your day.